Thank you for joining us tonight for this panel, South Asian Women Executive Directors and the Challenges of COVID-19, co-hosted by Desis for Progress and SABA-DC. It is my honor and pleasure to welcome you tonight and also to moderate the discussion. My name is Mo Sharma, and I'm the immediate past president of SABA-DC. And on behalf of SABA-DC, I'd like to welcome you tonight. I'm going to turn it over quickly to Nisha Ramachandran from DFP to say a few words.
Great, thanks, Mo. On behalf of Desis for Progress, I just want to welcome everyone again. Thanks for joining us today in, at least for DFP, our first virtual event back after we took a brief hiatus. I just want to thank the panelists again. We're super excited to have them join us. I know for many of you, this may not be your first time hearing from them. We've had a few of them on our panels in the past, and can happily say that I've worked with them, at least personally, all in various roles. So we've got a great panel. I just want to reiterate DFP's support for all of the work that all these four organizations are doing for our community. I think it's really important to have South Asian women in leadership positions like this. And so we're really excited to support them. We hope you will also support them however you're able to at this time. And with that, I will turn it back to Mo.
Thanks, Nisha. I also want to disclose fully to everyone that I'm currently on the board of Adhikaar. I was on the board of DVRP and National Capacity and SALT. I'm always interacting with them. So I'm a vested interest in all these organizations, just so you know. I'm not trying to be biased, but I just want you to know that. I'd now like to introduce the panelists. I first of all want to say that it's pretty exciting to have this panel of all South Asian women EDs, and also these women are phenomenal. We're really happy to have them tonight. I will also want to tell everyone listening in that if you have any questions you'd like me to ask, please message it in the chat and I will ask the questions. My introduction of the panelists are pretty short, but we're going to send around their bios and also the links to their websites after the event. The panelists tonight include Seema Agnani, Executive Director of National Coalition for Asian Pacific American Community Development, National Capacity, Pabitra Benjamin, Executive Director of Adhikaar, Krittika Ghosh, Executive Director of the Asian Pacific Islander Domestic Violence Research Project, also known as DVRP, and Lakshmi, Sridaran, Executive Director of South Asian Americans Leading Together. So my first question to you, and I think maybe we'll just go in alphabetical order for the first question, is can you all speak a little bit about your background, your education and career path, and what you did before you became ED? And we'll start with Seema.
Great, thank you. Thank you so much for having all of us. And yes, it is very nice to be with this group of people at the end of the day. So my career, you know, I have always had an interest in cities. You know, I grew up in the Chicago area and, you know, did my initial, I studied urban planning and public policy there, and really started to get involved in, you know, through the environmental justice field. Actually, I began my work in environmental studies and then, you know, came across an organization in Chicago that was working on environmental justice issues in a public housing development there. And that's really what brought me sort of into this part of the work. You know, they really all are connected. And then when I moved to New York, really began to work in the South Asian community and the Asian American community when I worked with AFI, Asian Americans for Equality. So while I was at AFI, we started to, you know, which predominantly served the East Asian community at that time, we really started to do outreach in the South Asian community of the Lower East Side. So that really brought me to this work. I guess one thing that I would say is, in addition to learning the skills and the issues through AFI, at the same time, I got involved in SAUCY. So a shout out to the South Asian women. I know Krittika has also been part of that, and probably the other panelists as well. But it's a network of South Asian women in New York in the creative fields, and a lot of artists and creative types. And I would say through my involvement in SAUCY, I really started to have a stronger understanding of what it is to build community, build leadership, and also, you know, the importance of, you know, building a network that's going to be supportive around you as you continue your work. So I'll stop there. That's sort of how I got into the work.
Krittika, do you want to go next? Even though Pabitra is alphabetical. Sorry, I just like you're next to me.
Sure. I'm gonna try not to like read out like my resume or something because it's just hard to like respond in terms of like how did you do this work. So I come to this work as a queer immigrant South Asian woman who's also a survivor, and I studied sociology and gender studies in undergrad and grad school. When I you learn about these things on a very theoretical level in university, and then when I was out in the quote-unquote real world many years ago, I knew that I wanted to work in immigrant communities. I moved to the US when I was 13, and I lived in New York City for most of my life till even till date, although I've moved around the world. And growing up in India, when I was living there, I was really keenly aware of the class and caste system that specifically kept young girls in particular from finishing school and having many of the opportunities that I took for granted. And I grew up with a lot of privilege coming from an upper middle class family, and I recognize that in my work because without acknowledging one's position and benefits that we have experienced, we can't do this work using an anti-racism, anti-oppression lens. So after college in Boston, I moved back to New York City and started volunteering with 2 South Asian domestic workers organizations, Workers Awaz and Andolan, and also volunteered with Manavi, a domestic violence organization in New Jersey, where I taught ESL to survivors. And during that time, I also got my first job at Sakhi for South Asian Women as a program coordinator. So like literally I was involved in every South Asian kind of women's organization in my after graduating from college. I learned a lot through my work, organizing work, and at Sakhi, and I will say that I realized the resilience of survivors who are often left out of the movement as leaders. There was a huge class divide between the leaders of the domestic workers and domestic violence movement, and I learned about dismantling stereotypes about who can and who cannot be a leader from the domestic workers who were also survivors of intimate partner violence and mobilizing their communities on both issues. This led me to eventually co-found the Shakti Peer Group, which was a peer mobilizing group responding to gender-based violence in New York City. And this was women who were survivors and community organizers who were usually only perceived as recipients of services, but also had a wealth of community mobilizing experience, which they challenged to talk about GBV in the community. And in my work, I've also developed, I've been working both in the US and in Canada for the past 20 years. Mainly in Asian American communities, our immigrant communities. And in Canada, I developed a large-scale public education campaign around responding to gender-based violence through the creation of multilingual graphic novels, and many of them were translated into South Asian languages to start conversations around sexual violence, which we don't talk about oftentimes in our communities. And that was disseminated to over 75,000 people in a year. As a queer survivor, I also, through my work, try to ensure that the spaces that I'm in are aware, that GBV occurs in all relationships and challenge the heteronormative responses in the movement. And that's something that I've been doing throughout the years, and recognizing that the GBV movement is very, oftentimes can be very heterosexist. Apart from my GBV work, I've also worked as a community organizer on post 9/11 hate crimes against South Asians and Muslims to raise awareness about supports and the repercussions of the special registration program, which was created as a database of Muslim men and a means to report them after 9/11. And I worked as on public health issues, managing a diabetes management program at the NYU School of Medicine in the Asian American community and the Bangladeshi community. So, apart from all of that, I think all of these experiences, not just, working on gender-based violence, but working in the community in other respects really helps me to kind of tie everything together and respond and do the work in a very holistic manner. And, I'm really excited to be a part of this panel and continue discussing ways that we can do our work, but also build leadership amongst our community members so that, we can have new folks coming on and taking on the baton and doing this work after we're gone.
Thank you so much. Pabitra?
Thanks for having me on the panel, and I'm honored to be on the panel with all of you brilliant women. I know that there's now degrees for organizing. That did not exist when I was in college. And so a lot of it is just through the lived experience, right? I didn't ever have a career path that said, I'm going to become an ED of a nonprofit. I just don't think that a lot of us came into the work in that way. And I think that, you know, everything kind of lands and develops and evolves as you go with the flow. And I think for me, that was the biggest lesson learned, was there was no like career trajectory of a 5-10 year goals. It was kind of taking opportunities as they arose and building with those opportunities, right? And so, you know, I come from ancestors of doing this work. My grandfather and my mom came from a small village in northeastern Nepal, and I hear stories of how he trekked from that village to Kathmandu for 3-4 days to fight for the rights of the village, right? Whether it was around agricultural issues or zoning issues or whatever it is. I was pretty young when I started to get engaged. I was about 15. I had traveled and moved around a lot. Every 2-3 years I was moving around. For anybody that moves around a lot, you start to learn how to tell your story really fast and make friends really fast. And I also came from an extremely multicultural household. You know, had a father who is my stepfather is white, my mother is Nepali. I come from a Dalit background that is also mixed caste. And so there was no sense of what normal is in my life. And the normal was already a very mixed normal. I also came out as being queer when I was around 15. And around that time frame, I was living in Wisconsin. And I really, you know, the issue of diversity, this was in the 90s, and the issue of diversity was a big one. The issue of affirmative action was a big one. And I started to really engage in what that sense of diversity meant for me, and to engage in what it meant to really belong, right? And what it meant for people like myself as a queer woman of color to really belong in the society, and how to create a more equitable society. And so in a lot of high school, it was just education, right? It was like doing a lot of panels and education. And then in college, I feel like it came into organizing and understanding that it's not just about public education, but it's about really understanding power dynamics and who has the ability to really, how do we have the ability to build power to change things in the way that we want to see them change. I wanted it to be normal that folks were queer, and that's just, it was cool, you know, and folks were folks of color, and it was cool. And you start learning about all these inequities. And so I say, you know, yes, I got a degree in political science, but I really got a degree of organizing through my work with United States Student Association, which doesn't really exist as much anymore, but really taught, you know, students from all over I mean, they do exist, but at the scale that it was, really taught students of color and queer students how to organize all around the country on issues of affirmative action, of issues of making sure students got welfare, because there were students that were parents that were going to school and needed support for their children, right? And that grew into organizing around LGBT issues. Right after college, I worked at the Milwaukee LGBT Community Center, organizing around stopping. At that period of time, there were a lot of, all over the country, bans on marriage for LGBT people. And so fighting the folks trying to push for a constitutional ban on gay marriage in Wisconsin. So I worked on that for years, and went door to door in rural areas, went door to door in urban areas, and really had to talk about LGBT issues to all sorts of folks. And my mother, who's a Nepali restaurant worker, come to the doors with me. And so got that sense of like, what is it really to organize on these issues that are really hard to talk about, right? And forcing myself to talk to a lot of folks about it. And that just evolved into a lifetime of organizing, from LGBT issues to post 9/11 issues to racial profiling issues to immigration issues. I spent my last 10 years, you hear my kid in the background, 10 years really organizing around immigration, and landed at Adhikaar in a way that I didn't expect to. And it's kind of history from there. But I think that one thing that always kind of sticks to me is to really learn what power means and how we build power, right? And I feel like that's the kind of course in history that I'm trying to still take.
Thank you, Pabitra. Lakshmi?
Yeah, hi. Also such an honor to be on this panel and to hear from these amazing women who are also my personal friends, but I feel like I just learned so much more about each of you in this introduction. So I was born and raised in Atlanta, Georgia, and usually I'm based in DC, but I'm back here in Atlanta with family during this time. And I think similar to Pabitra, also did not really set a career path to become an ED. And, you know, while I also come from an upper middle class family like Krittika, and really appreciate you acknowledging that, and I think it's important to name that too, was fortunate to have parents who really helped me understand race and class and caste at a very young age. And we spent a lot of our time growing up in a suburb outside of Atlanta that was very white and conservative. So it was a really difficult and painful environment growing up as a person of color, but also I think a really important time to see myself not only as South Asian, but belonging to communities of color at large and forming an identity around that first before even forming a South Asian identity. And I remember thinking my main goal back then was to leave Georgia and do whatever I could to leave this challenging environment, and was really lucky to be able to go to California for college. And so even though my current work is at a federal policy organization, my training and roots are really in local grassroots organizing, and that's where my heart will always be. And I started first as a student labor organizer at Berkeley, helping lead campaigns for a living wage for campus workers. And at the time, it was done through United Students Against Sweatshops, which I don't know if they too exist anymore. And also, like Pabitra mentioned, in California around the same time, there was a ban in the early 2000s that had been placed on affirmative action. So a lot of my work then was working with other students of color on trying to reverse that ban, which unfortunately is still in place. And then also preserving the ethnic studies department, which being, I think, steeped in the rich like cultural history of ethnic studies, and that ended up being my major too in college, was really kind of that degree in organizing that I didn't know that I needed, but was such a valuable experience. And so much of that work was not in the classroom, but was in the student organizing work that we did. And I know at that time, you know, it was hard not to see other South Asian students participating in any of that work. And so again, I feel like I continue to reinforce my identity as a person of color first before thinking of myself as South Asian. And then when I graduated college in 2005, that's when Hurricane Katrina happened in New Orleans. And for me, that was one of the most, I think, impactful moments that really, I think, left an imprint on me that I will never forget. And I ended up moving back to the South, a place that I didn't think that I would return to, but formed a completely new relationship with the South when I moved there after Hurricane Katrina, and worked, you know, in so many multiracial coalitions there between Black, Vietnamese, and Latinx communities. And we were working really hard to prevent the massive displacement of these communities after the storm, which was really the intended goal of the federal government and a lot of people who were in power at that time. But I think we got to do some really groundbreaking work, like instituting participatory budgeting for the first time in the city. And we were able to do that in the year 2011. I'm not sure if the city does that anymore, but it was a really great way for us to see the ways in which budgets are used, you know, to enforce discrimination against communities, and that certain things like that become even more apparent after a disaster. We also were trying to stop the privatization of all the public goods and institutions, which again was a goal in a post-disaster environment. So there was such a rapid privatization of schools and hospitals and transit. And so we were in a lot of ways not successful in stopping that. But I think the power that we ended up building across communities in those campaigns was something I'll never forget. And these for me are the crucial lessons that I draw on today during the current crisis, which I know we'll talk about a little bit later. And so as a result, my formal training is similar to Sima in city planning, but I always saw that as an organizing tool, and still something that I use as an organizing tool today. And yeah, I'll just say that I think it's these experiences of working across communities of color and building power in really challenging political environments that help ground me and have really helped me find direction and purpose as an ED, and especially coming now into the Asian American community to do this work, which for me, this is the first time I've ever done that. And it's been 6 years now and only a few months as ED, but these are really the things that I draw on to keep me going. So thanks.
Thanks, Lakshmi. Also, to your point about a couple months into ED, she's been working like the ED for years since I've known her. She's been working hard for a very long time, so don't let that fool you. Now I want to talk a little bit more about your organizations, the organizations that you work for. What is the mission of the organization? What work do you normally do? And how is COVID-19 impacting your work? And we can go, let's see. Pabitra, do you want to go first?
Sure. So Adhikaar is a worker center and a community center. We're based out of Woodside, Queens. Majority of our membership is in Queens, though we have been doing some national work on temporary protected status. And we have four program areas that we work in. It's immigration, workers' rights, access to healthcare, and language justice. And for us, our real mission is a very broad mission of human rights and social justice for all, but we really concentrate in those areas in terms of our work. And as a worker center and a community center, I think that our primary focus is around Nepali-speaking workers and the issues that impact Nepali-speaking workers. We mostly organize workers in informal industries. And so that our main memberships are from domestic workers, nail salon workers, but also restaurant workers, as well as Uber, Lyft drivers, gas station workers, and others. Our work has, we've had a lot of work to do around workers' rights issues, but I think that the COVID-19 has only exacerbated those inequities in terms of those with privilege and those without. A lot of folks, while they've been able to go to remote work, a lot of our workers have not, right? So when we look at the domestic worker industry, and we called about 1,300 folks within the first couple of weeks in our membership, and we talked to about 400 domestic workers within a couple of weeks. And I would say only 25% of them were working, and it was somewhat by force in that if they didn't keep going to work or go to live with their employers, that they were going to lose their job, right? There are, of course, essential workers that were a part of the major workforce, but not all domestic workers are seen as essential workers, right? And we had huge subsets of the population that had lost their job that were told, don't come back to work until I tell you to come back to work. They weren't getting paid, right? And so there are a lot of folks that have lost their income. We jumped within 1 month from having a couple of dozen calls around unemployment to over 400 calls around unemployment. And so set up virtual unemployment clinics to be able to support people because the systems were inaccessible, hard to reach people at DOJ in New York, and really just really hard to figure out all the ways in which it was changing as well. And so I think our community has been impacted really greatly, though the data is not disaggregated in terms of who's gotten COVID-19. We're really fighting for data disaggregation because it doesn't show that the API community has been impacted like in large numbers, but we know from personal experience that we've had our first 3 weeks were just folks getting COVID-19 and telling us they needed food, they had nowhere to go to quarantine themselves, that they needed support because they lost their job. And so we started responding really fast. Like one of the first campaigns we worked on was around quarantine facilities so that folks that were living multifamilies in one household or one family, or folks renting rooms or beds, had places to go in quarantine, right? Because that's one aspect of helping flatten the curve. We were also fighting for testing and accessible testing. And so I think there's a lot of ways in which we had to respond to COVID pretty rapidly because Queens and Central Queens was an epicenter of where a lot of epicenter for the pandemic. But there were also a lot of people that didn't have COVID that again were impacted by unemployment, were impacted by other issues. Nail salon workers, huge. We have about 2,000 nail salon workers we work with. All of them lost their job, right? They were told not to come back to work. We don't know what the nail salon industry is going to look like after this. And so it's not just looking at how is COVID impacting us right now, but the longer term impact of this on the industries that we're organizing in and for the workers that we're organizing with. And I think that there's a lot of issues that come about. I'm happy to talk about our work a little bit more, but I think that directly answers that question.
Thank you, Pabitra. Krittika?
So DVRP is a nonprofit organization in Washington, D.C. Our mission is to address, prevent, and end domestic violence and sexual assault in Asian Pacific Islander communities while empowering survivors to rebuild their lives after abuse. And our work is in the DMV area, DC, Maryland, Virginia area, but honestly, we get calls from survivors all around the country and sometimes internationally as well. It's pretty common. We're celebrating our 25th anniversary this year, and in terms of our work, we have 3 program areas. One is our case management, and where our case managers respond to survivors who contact us for support through a hotline. And in normal circumstances, will accompany survivors to court or to different appointments, connect them to services, and just be be there as a support to the survivor. We also do community outreach and training, which includes us doing workshops in the community, in the places of worship with different subsets of the community, like working in different ethno-specific communities, but also with youth, with seniors, and also not just doing workshops, but engaging the community to really think about gender-based violence and why it occurs and how we can be allies, how can we work together to end it. So really thinking about it long term, because taking one training isn't going to suddenly miraculously change people's behavior. So it's something that's ongoing. And then we also do the trainings, trainings for what we call mainstream organizations who don't necessarily serve the API community, but do DVSA work. And we train them around cultural humility to understand how to work within our communities, and provide them with tools to engage with, diverse communities. And last year we provided support to about 237 survivors, and trained over 1,500 individuals on domestic violence, sexual assault, cultural humility, and how to be an ally. And in the last 2 years, we've started new programs such as our trauma art therapy workshops in DC and in Maryland, which have been a great source of bringing the community together to really create artwork and support each other. And instead of this traditional support group kind of a space, the artwork brings people together. We've also received funding from the Times of Legal Defense Fund and the National Women's Law Center to work on the Me Too campaign, and we've been doing peer engaged work around responding to workplace harassment by training leaders in our community members to become leaders in their community around and working around spreading awareness. Yeah, so these are some of our program areas. And in terms of how COVID has impacted, so we've had an increase in our hotline calls and clients. We saw about a 77% increase in calls since the beginning of the pandemic, since February. And we have, as a culturally specific service provider for survivors of DV and SA, we understand that the weight of COVID-19 gets shouldered differently by our clients because there's some very specific ways in which our community is impacted. According to the World Health Organization, the strategies around preventing the spread of COVID-19, such as self-quarantine and social distancing, are dangerous for survivors because it is in close proximity to abusive partners, and increased care work on women, and taken away mobility to flee unsafe situations. And that is what we are seeing in our work, where survivors are calling us oftentimes on the down low when they are out on the street taking a walk, or if their partner is out of the home. These kind of situations occur pre-pandemic too, but now there are far less supports available for survivors. We've also seen that our clients are internalizing the rise in violence and hate crimes directed towards our community as a result of xenophobic and racist misinformation. And that adds an added layer of trauma. And there isn't, I think in New York, there's a lot more work being done to respond to hate crimes, and there's always been that case. I don't see that happening as much here in DC, and maybe Lakshmi can tell us more because it is happening, but there isn't we don't want to tell our clients to go and report it to the police, because that's very problematic. So we are, taking down what's happening and supporting clients on an ad hoc basis, but I think there's more that could be done there. And our staff are all working remotely and, and maintaining social distancing, but also, the kind of work that occurs on the phone, online, requires both staff and clients to have access to some form of technology and be computer literate, and that's not always the case when it comes to our community members, right? So the community members that DVRP serves, about 70% are don't speak English fluently. Our new immigrants have barriers in terms of immigration status, and also technology is not easily available, like having a Zoom, access to Zoom or smartphones. Not all of our clients have access to that, so that's proving to be a big barrier, and the pandemic is giving us a clear indication of the vast divides in our community due to class, immigration status, language ability, and more. So that's what we are seeing right now, and we're responding to it in ways that we can. But it is still, obviously it's challenging for everybody.
Thank you. Actually, Lakshmi, do you want to go next? Just because, yeah.
Sorry about that. Awesome. Yeah, so for SALT, many of you may know we are a national racial justice organization that was, formed right before 9/11, but really catalyzed formally in response to the increase in hate violence faced by South Asian, Muslim, Sikh, Middle Eastern, and Arab American communities following 9/11. And like Krittika said, we are seeing an uptick in that kind of violence. Again, today, a lot of it is around the racist misinformation, like Krittika said. And also, I think one of the things we like to focus on is state violence. So as we're seeing, interpersonal violence targeting Asian Americans and those who are racialized as such, we're also seeing an increase in police violence against communities of color. We've seen, many cases like here in Georgia with Ahmaud Arbery and others. And so I think our analysis is very aligned with DVRP, in which seeking a police response is not necessarily the solution that we advocate for. But one of the things that we are doing is tracking this violence in our database and looking at the trends that we're seeing. And so, of course, we're seeing an increase in white supremacist violence, and perhaps that merits a police response. But when we see incidents of interpersonal hate violence between young people of color, between communities of color, we feel like there needs to be a kind of different approach and political education involved in that. And so these are some of the more nuanced responses, and I think more refined responses since 9/11 that we've been able to develop as communities. And so SALT is in conversation with and part of many Asian American national coalitions that have formed in response. So the National Coalition of Asian Pacific Americans has put together a coalition to address this increase in hate violence. And so we're participating in those conversations and trying to advocate for these kinds of nuanced responses as we observe the uptick in violence, much like we saw also in the wake of the 2016 election as well. So that's a really critical part of our work that we're continuing, and see a lot of the same trends that are pre-COVID that are being exacerbated, like Pabitra was saying, these inequities during this current crisis. And a couple of other core areas of our work are around immigrant justice. And what that looks like now in COVID-19 is examining the federal legislation and the relief packages that are being formed almost every couple of weeks, and fighting to make sure that immigrants of all status can be eligible for the rights and benefits that they are entitled to. I know that is a very long and hard fight that everyone on the panel is waging as well. And that's something that we continue to do. And at SALT, we've always had a focus, and or at least in the last few years, a focus and a priority on the most marginalized South Asian population. So we consider folks who are undocumented, who are detained and incarcerated, who are on vulnerable visa statuses like Deferred Action for Childhood Arrivals, DACA, or Temporary Protected Status, TPS. And those continue to be the same populations that we advocate for and are seeing are being disproportionately impacted by COVID-19. And so really supporting the work of our partners who are in Texas and working in and along detention facilities along the border, where we're seeing so many South Asians alongside other immigrant populations being rounded up for deportation under these conditions, and the current executive order that the president issued about a month ago. So these are all things that we're continuing to support that fight. And then lastly, continuing to monitor issues of civil rights surveillance and enforcement. Even in the middle of all of this, we're seeing that the government has sort of resurrected the Countering Violent Extremism program under the name of TVTP. Terrorist violence and terrorism prevention is what they're calling it, with, of course, again, a disproportionate and overwhelming focus on Muslim communities. And so continuing to see the uptick in that form of surveillance and enforcement in our communities under these conditions. And so that, again, I think we see our ongoing work as very much connected to the same underlying pre-existing inequities and that continue to make our marginalized South Asian populations even more vulnerable. And so that's where our focus has really been. And I should add that we also facilitate what we call the National Coalition of South Asian Organizations, of which Adhikaar and many others are members, and it's 63 local South Asian and South Asian serving organizations around the country who are at the front line, many of them like Adhikaar, who are at the very epicenter of this pandemic. And, you know, we're hearing an array of concerns and issues that they are facing. And so some of our work as well has been to try to direct resources to these frontline organizations, really understanding our role as a national intermediary organization right now, not being urgent in the same way, although our work is important and continues. We established a South Asian Guide to Giving that has many of these organizations featured, and really encourage folks to continue donating to these frontline organizations. We have also established a COVID-19 resources page that has crowdsourced a lot of critically important resources that have been translated into South Asian languages. So that's another kind of resource that we're providing. And then of course our hate tracking work, which is also public and available online for folks to check out, and now includes a revised reporting form for folks who feel comfortable reporting any incidents of hate violence and discrimination. So that's just a little bit about our work and how we're shifting in these times.
Thanks, Lakshmi. Seema?
Thank you. Yeah, so National Capacity, you know, we're a coalition of about 100 organizations now. You know, our core work has always been really focused on housing and economic justice issues. You know, National Capacity started as a group of about 15 community development corporations, so nonprofit developers who, you know, own and manage housing, but today has expanded to include everything from, you know, youth organizations, community organizing groups, to, you know, very large multi-service organizations. So extremely diverse. And also, you know, we have really built a coalition that, you know, I'm proud represents the diversity of the Asian American and Pacific Islander community more and more so, where making sure the groups that are often underrepresented in API organizations are, you know, centered in a lot of our work. So National Capacity, you know, we function, one, as a coalition in terms of our policy advocacy work, really trying to push for our issues on the national level, lift up the stories that are coming from our communities, but then, you know, similar to SALT, you know, serving as an intermediary. So we re-grant, you know, 1 to 2 million each year to support things like housing counseling, small business assistance, and financial counseling. And so really, you know, a lot of our core work has become even more important right now. And so we're really trying to do our job of really supporting groups that are working locally. When I talked about my career history, I didn't mention that I was with CAPACD, which is based in Queens, New York, and works closely with Adhikaar and SALT and others as well. But those groups that are working in communities are, most of our members, as soon as the pandemic hit, had to shift gears and, similar to what Pabitra shared, started focusing on things like getting access to food and shelter and just baseline services at first. Those that are working in small businesses, a lot of our work is really focused on neighborhood. And so immediately, as early as January, we were hearing losses of income as high as 80% in a lot of the Chinatowns around the country, primarily because of the racism and xenophobic rhetoric that was being perpetuated on the national level. And so that continues. And, a lot of our groups, in addition to trying to work in the community, are, the counselors and organizers themselves are facing discrimination as they're doing their work, and so there is that added layer really compounds the challenges. As was pointed out, there is limited data, but the bulk of low income Asian Americans and Pacific Islanders, 73% live in the highest cost housing markets in this country. And so for that reason, the issue of gentrification and displacement has always been a priority issue for us. And this pandemic will really only worsen conditions for many residents and small businesses who are at risk of being displaced. I think I'm sure many people have been hearing about the cancel rent campaigns. There are efforts to drive resources for rental assistance. That's really urgent, because as soon as these, as soon as the shelter in place orders are lifted in these areas, evictions are going to become much more common, unfortunately, and we're already hearing landlords threatening tenants. So a lot of our communities are at risk. So what we are really trying to do is focus on getting resources locally. We also have been trying to support funds that our members have set up to, provide rental assistance. A lot of the support that's being made available on the national level really won't reach our communities for multiple reasons, immigrant status, but also language access. We did a little bit research using the American Community Survey and identified that there are 3.4 million limited English proficient residents in the COVID hotspots today, and a lot of the languages that our communities need are not being made available. And so, the work that SALT is doing is really important, and we're also trying to support our groups in helping them translate information and resources. There's a lot of scams that are emerging. The PPP program, the Payment Protection Program, that was meant to support small businesses. Really, because that isn't really reaching our communities, a lot of fraudulent actors have emerged. And so just recently we started to do work around that, also translating information and make sure our communities don't fall prey, and whatever savings they do have don't get lost to these scam artists, because there really isn't room for that right now. And we work in a time where government really, on the national level, is not stepping in and doing its job. And so, communities are having to take care of each other and take care of themselves. And so we're just really trying to see what we can do to support those models. We are also launching a fund. We have a fund we're going to focus on regranting. But we're sticking to our institutional donors, because we don't want to compete with a lot of the local funds that are already out there. So we're going to be supporting work of our organizations and really reaching the most vulnerable, which we see as limited English proficient seniors, and you know, those that are working on in cash-based earners, you know, the clients of Adhikaar and many others that really have trouble documenting income, and in the end won't be able to get relief for a lot of technical reasons, as well as immigrant status. So I'll stop there.
Thanks, Seema. I'm actually going to go into something that you had mentioned, but I'm going to sort of shift to the next set of questions. And it's sort of delving deeper in the issues that are impacting your work in the time of COVID-19. Can you speak about how the following issues are impacting your organization? So I'm going to list out different issues at different times. I think the first issue is housing and shelter. And Seema, you started speaking about this, but if there's anything else you want to add, and then please all jump in, and then we'll go to the next issue and the next issue.
Yeah, I mean, I guess some of it was said already, you know, because our communities are living in the highest cost cities, you know, people live in multi-generational households. We have some of the highest rates of any communities of, you know, families sharing, or even, you know, workers sharing housing. And so for that reason, it puts our communities at higher risk of, you know, infection, but then also it leads to a lot of these other issues in terms of potential for eviction and loss of housing. And also on the homeownership side, you know, really not a lot of our communities are aware of what options are available. So whatever folks can do to make sure that people know that there are relief options available for homeowners and renters, you know, hopefully more and more will become available soon. That's coming up in the next bill on the federal level. And then I know a lot of cities have also put things in place to support owners. But I think, you know, the overcrowding is very real. And, you know, as people get pushed out, you know, they're at risk of homelessness or, you know, displacement on a scale that we probably haven't seen in a long time in this country, unfortunately. So we are pushing for bolder solutions. We don't want to go back to the way things were. They weren't good enough to begin with. So I think, you know, what the organizers have pushed us to do is really think on a more systemic level and think about what are the ways that we can actually improve conditions for people and not just go back to the way things are. So pushing for broad investments in housing, and thinking about, you know, as properties go into default, as buildings go into foreclosure, let's make sure that those get turned into affordable housing and don't get eaten up by investors who are really buying out our cities, you know.
Does anyone else want to add anything?
I think that rent has been one of the major issues that folks have called us on. We don't organize around housing issues, but at the same time, we can't not do any of the work right now. And so I think for us, we are going to be picking up the rent suspension campaign or the rent freeze campaign, and been collecting a lot of stories around a lot of our members who are facing issues around rent. But it's not just folks that are renting, but folks that may be renting a bed or renting a room, right? What happens if there's no contracts? What happens in those types of cases? And then how are people really getting the service provision that they need in terms of legal support, right? Is not something that we do, but we know that there's not, like, even organizations like CAPACD is not going to have the capacity that they need to take on all the cases that will happen when in August the moratorium is no longer there, right? And we're already seeing issues of folks that don't have contracts getting kicked out of their homes at a really critical time. So I think it's an important one for us. And again, like, because of the pandemic, a lot of us have had to pick up issues that we don't work on. And this is for sure one of them where we're like, it's not an option to not push for rent suspension and a rent, not just a rent freeze, but so that folks don't have to go back and pay their rent for the months that they were unemployed.
So I'll just jump in as well. For DVRP, what we have been seeing is a lack of options right now for survivors who are choosing to leave. And if they do, if they're in the shelter, I mean, I think a lot of homeless shelters, that's where, survivors, many survivors are. We've had an issue in one particular shelter, for example, where they were forcing the survivor to look for work at the height of the pandemic, and wouldn't understand why the survivor doesn't want to leave their young child alone, because if anything happened to her, then the child would be completely by themselves. So, so a lot of our work is training other service providers on understanding how and breaking down how this is not okay, and how problematic it is for immigrant communities in particular, and in our communities right now, to go out without having safety. Like I said before, many survivors are choosing to stay at home at this point rather than leave, and those that are leaving are finding it difficult to find shelter and housing. And for the South Asian community, oftentimes when a survivor leaves, we have survivors who want to take, obviously their children and then maybe their elderly parents and move out, and to find spaces that would welcome families such as this has been an issue and challenging right now, and it is even when it's not a pandemic. And there is very few housing options that are very culturally specific to our community, that recognize the needs for example, halal food, or having things there for our community members that wouldn't be in a mainstream kind of shelter space. In a positive note, there is a survivor currently in a shelter who was supposed to phase out of the shelter and move out, and this is a shelter that actually has been very understanding, and and has told her that she can stay there for as long as she wants to right at this point. So it's kind of like pluses and minuses, but also we are also trying to look at things at a more systemic issue level, to see challenge, for example, this notion that women have to go out and find, or survivors have to go out and find jobs right now in the middle of the pandemic to show their value and their worth. A lot of what's happening right now is about, maintaining a capitalistic system, which doesn't take care or doesn't care about, brown and black bodies. So I think that a lot of the work that we are doing is really challenging systemic issues, even within other service providers who are, who we are interacting with.
Thank you. If there's nothing else to add, I'm going to go on to the next topic of food insecurity. Can you please speak about how that's impacting your organization right now?
I know for us that, the food insecurity was happening with a lot of different individuals. And there's a lot of mutual aid not organizations, but mutual aid groups that were created. And it's been beautiful to see the ways in which community has come alive to support one another, especially in the Nepali-speaking community in Queens. And I think there's a lot of mutual aid around food assistance, grocery delivery, and all of that. Adhikaar didn't do that for the first month, for the first 8 weeks, partially because there were a lot of other orgs doing it. But I think that one of the things that we're seeing now is, as people have now had 2 months of unemployment, not everybody is getting their stimulus checks. Even if they are, $1,200 doesn't go a long ways, right? People are saving whether they're going to have to pay rent or not, and making a lot of decisions. So now is the time that we're starting to see a larger piece around food insecurity. And we're starting to think it can't just be that we pay for food for a week, or it can't just be that somebody provides food for another week, right? There needs to be a longevity in how we're thinking about food security for our community, and making sure that we have direct access to food. But also, how are we thinking about the sources and supplies for food, right? To cut out the middle folks and maybe go to the farmers to be able to get the food. So looking at different ways and different systems and how we can do food delivery that doesn't rely on us having to, if food delivery was all we did, we'd spend, $10,000 to $20,000 per day just doing food service. And I know there was an increase from the CARES package around for pantries, but at the same time, those pantries are not accessible. There's lines around blocks to get into the food pantries. Also in terms of culturally accessible food, that's something that we have to be extremely thoughtful about. If we give a whole bunch of people pasta, they don't know how to make pasta, like we got to give them rice and dal, you know? So I think that there's ways in which we're thinking about this in a little bit more complicated manner than just here's some food for a week.
So for us, what we're seeing right now, actually one of the main needs that survivors have in the community is access to food and having a lack of access to it right now. Many of the survivors we work with are on food stamps, and in the South Asian context, for many, the food stamps act as currency because they share it with family or people that they live with, you know, instead of paying rent, they're sharing the food. And right now that is being very limited. I know that a lot of us probably saw this on social media, how there was a thing about, like, you know, in the first week or the first couple of days of the month, you know, if you can avoid shopping, avoid it because people with food stamps need to go. What we're noticing is that in the beginning was that a lot of the essentials were completely sold out, you know, in terms of having access to milk or eggs or whatever. So that is what we noticed. And also, like I mentioned, survivors in shelters may not be getting access to culturally specific foods. But in a positive news, we did have one survivor in a shelter who a lot of the shelters have moved into hotels now because of, like, to stop the spread of COVID-19. There is one particular store in Springfield, Virginia that wants to remain anonymous. It's a halal grocery store who's sending a survivor free food via Uber, sending many survivors actually free food by Uber. And, you know, the community is stepping up, you know, but this is definitely on a more one-on-one level, which is also needed as we're looking at how to, like, respond systemically.
Thank you. Does anyone want to add anything else? Should we go on to the next topic? The next topic is DV. Actually, Krittika, you can start, but I know that it's probably you all are seeing a little bit of it, like DV, sexual assault.
So, I mean, like I told you earlier, Mo, that my response to this is that, you know, what we're seeing in domestic violence is across all of the issue areas that we're discussing, right? Housing or food insecurity. So it's not just like DV only by itself. So at DVRP, we currently have 79 open cases that are 3 case managers are responding to, and we have a South Asian specific case manager who speaks Hindi and Urdu, and she has responding to 20 cases right now. So it's about 25% of our cases are South Asian at the moment. What we're seeing is that survivors are experiencing greater isolation and financial and emotional violence and abuse. And one of the things that we are seeing constantly happening since the pandemic hit and is the tax stimulus of survivors are being taken away by their abusers. They're strategically finding ways to ensure that survivors are not getting access to that money. So that has been a challenge that we are really working, you know, to figure out an alternative on. So, you know, it's really a lot of manipulation strategies that are happening, you know, on the basis of the perpetrators. About 75% of survivors' jobs have been taken away, and those whose jobs have not, you know, have not lost their jobs are hesitant to step out to go to work. You know, like I said, single mothers are worried about their children, what's going to happen to them. There's, you know, a lot of survivors are here, you know, isolated from their community on their own. So there is a lack of having that community support right now. Although courts for the most part are closed, there's like you can get an emergency order of protection. Legal cases are still open. So we have actually a survivor, you know, who is a deaf survivor and who needed language, you know, access support. And at the very beginning of the pandemic, our case manager had to go and meet her face to face because there was no other way to communicate in a very effective manner. And her case is around her VAWA petition. And so we're continuing to work on supporting these legal cases that are out there, whether they are for, citizenship, whether they're for divorce or for the VAWA petitions. And, just because the courts are, they have just delayed the opening of the courts. So once they open, all of these are going to go on the docket. So this is continuing. And one of the things that is challenging for us right now is the outreach, our outreach, which is primarily online at the moment. So we are very, we have, a very strong social media presence, but that means that we can't hand out information to pockets of our community who are most isolated, may not be on social media. And there, we're hoping that there are folks on today's, who are attending today will take our information and spread that information to their community, because that's the only way we can get the word out right now, because we can't go out there and be handing out like flyers and information about DVRP and our work. So, also we know that during this time, that domestic violence, sexual assault is increasing. You will hear different things from different people, because a lot of organizations will say that the number of calls have gone down, that maybe because people are home and cannot make those calls. But we have, for DVRP, have definitely been getting an increased number of hotline calls since March. And, the violence is taking place in different forms. Like I said, it's not always physical, it's emotional, psychological, financial abuse has definitely gone up during the pandemic. And because also now people have nowhere to go but stay in, that is causing a huge rupture and, further escalation of violence. And it's also something that we're going to see in terms of families that are together with children observing violence in their family. Like we're going to see the outcomes of that, not right now, but in the future, because we know that, that leads to, definitely can be challenging when it comes to how, when children who see violence in their homes and have no support themselves, that can lead to further violence in their lives. So these are all issues that we are aware of and we're working towards, and we've kind of been developing materials around safety planning more and more, and available in our different languages, as well as how to safety plan when you are staying at home with your perpetrator, because that is not something that we in the past maybe have been doing as much, but now we've shifted towards that.
Thank you. Does anyone want to add anything else? It's okay if not. How about immigration issues?
Lakshmi, you want to start and I'll jump in?
Sure, yeah, happy to. Thanks, Pabitra. Yeah, I think with immigration, like I was saying before, there are so many issues around this, especially under this administration, that were so challenging even before the pandemic. And I think what we're really seeing, and I think this relates to workers' rights too, is the ways in which immigrant labor and workers are being exploited on so many different levels. The last executive order issued by this president is, banning essentially people from accessing green cards for the next 60 days. And, it was seen in some ways as a win that so-called essential workers were left out of this, and yet what we continue to see is that they were very purposely left out of being excluded by this executive order so that their labor could continue to be exploited to carry us through this crisis. And so I think immigrants across the, immigrant status spectrum are being impacted. And as I was saying before too, the detained immigrants and migrants who we work with are, facing COVID outbreaks like all folks are who are in incarceration right now. And just the gross mismanagement by ICE is inhumane and illegal, really, the way that they're treating migrants. And so I think that's another huge issue that we're seeing. And that same executive order that's also banning folks from getting green cards is also the same one that's being utilized to line up migrants who are in detention to be deported back to very dangerous conditions in their countries of origin. And that has been really complicated because many countries of origin are actually not repatriating or accepting migrants back into their countries because of COVID-19. And so people are just languishing in detention indefinitely amid the abuses that existed pre-COVID-19, in addition to these COVID-19 outbreaks in these facilities. So I think these are just some of the immigration issues that we're seeing right now. And then of course, just seeing so many immigrant communities being left out of the benefit and relief packages. And I think on top of that, we've seen the overlay of the public charge rule as well, that, you know, basically criminalizes immigrants from applying for green cards for using and utilizing the public benefits that they have paid into over all these years, which is also having a chilling effect for people to apply for these benefits that they should be getting. And so I think those are some of the things that we're seeing in terms of the implications for immigration, but I know there's so much more too.
Yeah, I think that, I mean, we've seen, you know, ways in which all sorts of immigrants have been left out of federal, state, and city level relief and recovery efforts, right? And this is a continuation of a long line of abuse around immigration issues. I think that for us, there's two things I want to talk about and concentrate on. One is TPS and the other is undocumented folks. I think the COVID-19, you know, we at Adhikaar and our membership of about 5,000 had a lot of undocumented individuals before we were able to fight for TPS in 2015. And then a lot of our members ended up getting TPS because we had fought for it, and then also did a lot of legal clinics to support folks. I think that in terms of the undocumented folks, one of the things that we've had to kind of come to at Adhikaar is this recognition that there's a lot of undocumented folks in the Nepali-speaking community, and a lot of folks have started to call us after COVID-19. So though we weren't doing a lot of the organizing around undocumented South Asian folks, it's something that we've re-examined at Adhikaar to say, actually, we have to be doing this work. So we joined the Excluded Workers campaign on the New York State level to make sure that folks are getting financial support from New York State. Governor Cuomo has been really resistant to this, and I think that we need to really fight him on this. The folks were left out of the federal stimulus package on the first go around. The House version that's out right now that the Senate has not picked up does have some stuff around ITIN and mixed status families, but it doesn't include all immigrants that have been left out. And it really is not just on the federal government, on the states and the cities to also support folks. So even though New York City is even took a huge OSF grant to support immigrant families with $500 or $1,000, there needs to be much larger efforts made, because that's not going to support all the undocumented folks out there. And it's not just about the undocumented folks, it's about a lot of the folks that, as Seema mentioned, or I think earlier, or Krittika, I'm not sure, I'm sorry, but around folks that, you know, might be working on under the table, right? And they didn't pay their taxes, therefore they aren't eligible for the stimulus checks. There are a lot of folks where in situations where for us as well, where we will, if we are going to be doing emergency relief, we're actually going to deliver the cards so that people can't take it away from them, right? And so I think there's a lot of complexities in how we have to think about the relief efforts and the recovery efforts that are not being made toward immigrants, and what we have to push on. On the TPS pieces, I think that one of the hard things is that a lot of TPS holders could lose their status in the middle of this crisis. And we're talking about 300 to 350,000 individuals that have community and home here, right? And we're really worried that the litigation, that the lawsuit will go the wrong way. And then all of a sudden by January, we're gonna have hundreds of thousands of people that will lose status. For Nepali TPS holders, that's about 15,000 people. And so we don't want to be dealing with another crisis of folks losing status in the middle of COVID response and recovery. And so I think that for us, we've really been pushing that, though it's not the time to work on immigration reform, that immigration reform has to be a part of the federal packages that are happening right now, that we need to make sure we're extending status for individuals who might lose status, whether they be DACA folks or TPS folks, but also for other folks that have been stuck here, like on visitor's visa and need 90-day extensions because they can't go back home. So the status extension piece is an extremely important part of this conversation that we can't skip out on. There's a lot of other immigration issues. Adhikaar with Undocu Black, African Communities Together, and Haitian Bridge released like set of demands, and one of them was around TPS status, but others was around release all the folks in detention and stop deportations, right? It was also around making sure that all immigrants got stimulus support, and that Medicaid is available for all, no matter what your status is around the country, and that there's really money going to states to support immigrants. So I think that immigration is a really important issue to be concentrating on right now.
Thank you. How about mental health? What's going on with your members or the people that you're interacting with in terms of mental health?
I'm happy to start. I've talked a lot, so if somebody else wants to go. I think mental health is a huge concern, especially as people were losing jobs. I know in our nail salon organizing, our organizers were spending hours with members, right? Because folks that were in quarantine were isolated, has lost their jobs, didn't have people to talk to. We've developed as a response, worked with a group that was based in Baltimore that was working with the Nepali-speaking Bhutanese refugees who are of Nepali descent. There was a high rate of suicide in Baltimore. And so they developed a curriculum that was around peer-to-peer education, but also peer-to-peer support. And so we reached out to them, and they're training a slew of our member leaders to basically be peer support for other members that have lost their jobs. It's a huge part of this work. And I think that we need trained member leaders to be able to support one another, but then to also know this is when we actually have to refer people to a trained therapist, right, or a certified therapist. And so we're trying to develop a network of Nepali-speaking therapists who we can then refer people out to at low cost to no cost to be able to support them, because we know it's not just this week or next week or even till December. The mental health concerns around this are going to draw out for a while.
I'll add to that definitely this is, all the things we're talking about right now have been ongoing, right? It's just that right now they're exacerbated due to COVID-19. And many in our communities, there's a stigma on mental health and seeking support, right? I had a conversation with a survivor recently about, seeking, therapy or support. Then in Bengali, she was like, so she was saying that, do you think I'm crazy? And I had to do a breakdown about what does that mean, and why it's important to get support. So I think breaking the stigma is a first piece of it. And then secondly, even when there are survivors who are seeking support, there is very little that is culturally specific in their languages, right? So a lot of the survivors that are seeking support have to have an interpreter with them, which can work on many levels when you're going to court, for example, right? Or to other services. But when it comes to therapy, you're sharing your internal, what's happened in your life or whatever, I know that for me to have somebody else in the room, no matter how much I trust them, it's just no, I need this time one-on-one, but that's not always available for survivors that access our services. And also, in talking to our case manager who works with the South Asian community, it was clear that people are really worried. There's high levels of anxiety, but mental health is not being prioritized right now. We have seen that Maslow's pyramid of hierarchy or whatever of needs, and so their needs are shelter and food primarily. The therapy comes a little bit later, but mental health issues are definitely ongoing, and that we are seeing that, it's not, and like I said, it's being exacerbated due to the pandemic. But yeah, but there is not enough out there to support folks right now. So that's why for DVRP, we've kind of created programming that's aside from the traditional notions of what therapy looks like. So that includes our trauma therapy art workshops, which we might be doing online based on where we are in a month or two. And we've created other space like our Artists of Voice, where artists, including survivors, share their artwork and performances and things like that. So we're creating other spaces where people can come together. But definitely there's more need for more support when it comes to mental health.
Yeah, I mean, I think I'll just add, you know, I think we're really concerned about the seniors in our communities, you know, facing, you know, severe isolation and also, of course, being at high risk. And a lot of our groups are, you know, working with artists to somehow reach the senior citizens and, you know, using the arts to bring people together. You know, there are major gaps in our community, and, you know, as has been pointed out, there's also this hesitance to access any kind of mental health services in general. And so, you know, I think a lot of our groups are finding creative ways to reach community and engage with them. That's really beautiful. And I think it's, you know, all the issues that you've been raising, it's really hard to talk about one without talking about the other, because they really do all intersect, and really this crisis has made that so real, really, that you can't separate health from housing, from, you know, any, you know, mental health. So I think a lot of what we have been talking about for a long time about our need to not work in silos is really emerging right now. And I think that's the good thing that will come out of this, is we'll learn how to do things a little bit better, hopefully, you know.
Thank you, Seema. Just a couple more of the issue area-based ones. How about issues impacting the LGBTQIA community? I know that it's cross-sectional in terms of the issues you guys deal with, but is there anything in particular you'd want to add?
So, okay, I'll go. It's not something that I'm necessarily seeing in my work, but I can say out of experience what I'm seeing are the challenges. Around work, I'll say in general, is that the agencies that work with the LGBTQI community in general, the mainstream ones, don't really have knowledge that are about cultural humility or specificity. So it's always this whole like push-pull effect, you know, in terms of organizations that either serve a culturally specific community but have no expertise around working with LGBTQIA folks, or the vice versa, right? So that's kind of like challenging, particularly in times like this. You know, isolation also impacts the community differently. So many of us, you know, from the community are already isolated from, maybe isolated from family members due to homophobia or transphobia. And, you know, chosen families are usually the lifeline, and which is currently available in a limited form, you know, as we know, because we're not able to see each other, like spend time one-on-one. And I think there's a lot of things that are happening right now that like organizations like Encapia and Push DC, at least in the in our areas, and I'm sure there are others around the country that are providing support to folks through creating like networks and like events both as a support group thing or also like a social thing. Like I attended a Encapia brunch a couple of weeks ago, and that was really lovely to like meet with folks from across the country and just like chill out, you know, not like talk about anything heavy except who our celebrity crushes are, you know. So sometimes you need those moments of levity. I also imagine, you know, we've been like, I think a lot of like young folks who may have been in college or away from home and have to come back home. That's also a challenge for folks in the LGBTQIA community in particular, who've had to like, you know, kind of like have built their own resiliency outside of home and maybe build their community, and have to now be stuck with families who may or may not be supportive. And I think even for the community, mental health supports are key and need to be highlighted, you know, and particularly right now, I think it's like really important to talk about the impacts that we're facing, not just based on our identity, but all of us are experiencing right now.
Thank you. And now, there's so many more things we could list out, but is there any other legal issues or issues that you want to talk about in particular? It's okay. Oh yeah, go ahead, Seema.
I mean, legal issues more broadly, there are definitely a lot of areas that are emerging and where there's going to be a lot more need. You know, I think, you know, on the small business side, of course, a lot of small businesses are going to need support negotiating leases and, you know, finding ways to, you know, rebuild. And the same goes on the housing side. Obviously, you know, I think a lot of legal aid organizations are gearing up, but connecting those. And again, you know, there are real barriers and gaps in terms of South Asian language capacity. And so I think that's another place where this community could step in and provide a lot of support and added resources. And then I think, yeah, I'll let others speak. I'm sure there are more, but those are the two that I see in the immediate future emerging. You know, the eviction prevention, we're gonna need as much investment in that as possible.
Yeah, I mean, agreed. And I think, you know, we talked about communities that are being left out of the relief and legislation. But I think for those who are eligible, actually being able to apply for those benefits has been extremely challenging. And we're hearing from a lot of our NCSO member organizations that having that kind of legal assistance and support to fill out those applications is really critical. And a lot of the frontline organizations who are service providers are having to stretch and expand their resources to provide that. And so I think that is a real area where the legal community could step in to provide that. And then I think, again, going back to detention, there are so many legal issues that are associated with that were a challenge even before. And I think now getting South Asian lawyers and others to support people's asylum cases is really critical. And also, you know, one of the things that we're looking into at SALT is actually starting a South Asian bond fund, because that also feels like a really critical legal and resource need right now for folks who are detained. So those are a couple of the legal issues we're also seeing.
I want to reiterate the language access piece. You know, as an organization that works with thousands of individuals, where it's not a prominent language that's often translated for, it is one of the main things that we will do for folks. Like with unemployment, we had to find Nepali speaking lawyers who would help people fill out their unemployment forms, right? I think that especially as systems are changing so fast, it's already hard as an English speaker to keep up with how fast those systems are changing. And as somebody that understands system, it's hard to keep up with how fast those are changing. But I think if we don't make things language accessible in all the various languages, but not just language accessible in terms of reading, but also that we have a lot of limited literacy individuals at our organization. So one of the first things that we did was to create a video series. We did about 15 of them because we knew that there was just especially in the day of, you know, massive information on the internet, how do you parse through that to say what's the right information? How do you make sure that things are being translated well, right? And how do you make sure that it's really accessible to all community members? And so we did a series on COVID-19 and all the different systems and how to make sure you knew how to access various systems, which led to, of course, more work in terms of services for our community members, for our staff. But at the same time, we thought it was a really key part of how we have to do this work right now.
Thank you. Is there anything else you want to add about your work or your organizations? And in addition to how can the community help? How can people help you all right now and support the community in a proper way? And what do you think people can do? The people that are in attendance and people in general too.
I guess I'll go. In terms of, you know, one of the things I haven't mentioned that we're doing at SALT as well is actually that I think brings together a lot of pieces of this conversation is issuing a report this summer on the impact of COVID-19 on South Asian communities across the US. And we'll be doing it as sort of a series that will kind of be rolling out you know, on a weekly basis. And so what we're really trying to focus on is the regions of the US that have really high South Asian populations, like New York, New Jersey, Chicago, Bay Area, Houston, Atlanta, but also communities that are often overlooked and are also experiencing a disproportionate impact. And also, you know, looking at the range of issues, a lot of what we've discussed here today around COVID infection and fatality rates and the lack of the disaggregated data that's really needed to understand the magnitude of the impact, although we know as a community what's happening, and also access to healthcare and public health resources, unemployment, workers' rights, and immigration and domestic violence. And so those are stories that we'll be collecting in the next several weeks, and also we'll be issuing a survey to the community broadly so that people have an opportunity to even discuss the individual impact that this pandemic has had on them. So that's something that we're asking everyone to participate in terms of taking the survey. I would also encourage folks to visit our South Asian Guide to Giving that we released last week to be able to find organizations in your region to donate to. And so those are just a couple of things that we're working on and that we could really use support from the community.
How about the rest of the organizations? How can people be helpful to you all right now?
Do you want to pull up the document I sent you?
Yeah, sure. Give me a second.
Well, I'll go over it anyway. So, one of the things that we need most really is at this point support for survivors through financial support, which include things like gift cards for grocery stores. So gift cards to like what is it called? Whatever local grocery stores around, or even Target. Help with payment of utility bills. Help with rent payment, help with moving expenses. A lot of survivors, every couple of days, I get requests from our case managers to be like, such and such person needs to leave their home, but doesn't have the money, the first month's rent or whatever. So we, DFP does what we can, but we are counting on support from the community to be helping us with that. We are also looking for volunteers to currently, the unemployment application is taking hours and hours. It was something that was like really fast and quick in the past, but now because of the backlog, it's taking survivors hours to navigate through. So we could use support to do that, and also just spreading information of our existence, and that and like saying that contact DVRP if anybody is in need, and not like as necessarily sending it to specific people, but just as a general thing in your social network. One of the challenges that we're facing right now is also a lack of having access to pro bono attorneys who take family law cases in the DMV, and specifically in Virginia. That's been a big challenge for us. So if you know of any folks who would be willing to give their time, or you yourself are an attorney who wants to help out, you could use your support in that way. And I think the next slide has our contact information in terms of our social media, and you can also contact us at this number. You can contact me at this email address, but also info@dvrp.org is another. We just like looking for support in multiple ways, but definitely support for emergency support for clients for all of the reasons that I have been talking about is really essential right now, and no amount is too little.
Krittika will share the information actually for all the organizations after, like your contact info.
I'll go next. You can share a slide, but you don't need to because we've kind of talked about all of the work. Just a general, like when we began COVID response work in early March, we categorized like 4 ways in which we wanted to do our work. One was around direct relief and services. Second was community education, campaigns and advocacy and organizing. And one of the things I would say is that we're fundraising like crazy because a lot of the organizations that have gotten a lot of funding are those that have the capacity to do massive fundraisers, right? So those of us that are smaller have not had time to put effort into a direct fundraising effort. So I would say that trust in us that are doing the work on the ground and donate to us. I know Mo's got a fundraiser going on for Adhikaar right now, so you can even donate to Mo's fundraiser. But I think that, our work, I think, speaks for itself. We did this because this graph that you can see to say, this is what we did in 10 weeks, right? And with very limited funding and staff capacity. And I think with more funding, we have the capacity to do more work. We are doing direct emergency relief funds to workers right now. I think that is the #1 place where a lot of money is going. We're starting to do food and supply delivery to workers. But beyond that, it takes a lot of capacity to be able to do the service-based work. It takes a lot of capacity to do things like virtual unemployment care clinics. As Krittika said, one application can take 2 hours, right? And I think that what we really ask is that folks actually donate to help us as an organization survive and thrive so that we can continue to do the good work that we're doing. But also if there are Nepali speaking individuals out there that are either lawyers or licensed therapists or want to just support with the work, we can use more and more individuals that are Nepali speaking to help us in all sorts of ways. You can contact us at info@adhikaar.org. And Mo, if you want to share our information, please share that as well.
I'll do that.
I will just ditto everything that's been said. You know, I think the best way to help right now is to support local organizations that are doing the work. You know, I know everybody looks for volunteer opportunities and things like that, but in the immediate, really resources are needed. And if you give to those groups that are directly doing the work, it'll get to the right places. You know, I think the long-term recovery and rebuilding it's going to take time. And so in terms of engaging on that process, you know, providing some of the legal support has already been talked about, but, you know, also weighing in on some of these issues. You know, public pressure does work even in these political environment, the political environment that we're working in. It does make a big difference to really voice support. And right now, immigrants are where, you know, they're holding the line, you know, and so we need as much public support for immigrants broadly as possible in this moment. And so whatever people can do to support those is important right now.
Could I add on to something that Seema said?
Yes.
Which is, I think the broad-based support for immigrants is important. And one of the trends I've been noticing is we want to highlight the essential workers, right? But I also think that in highlighting essential workers that are just doctors and nurses, it's doing injustice to all the essential workers that are out there, grocery store workers, drivers, domestic workers, right? But so I think it's important to realize the essential work of all workers, delivery folks, right? But in addition to that, if we keep just sharing the story of essential workers, one of the things that's happening in negotiations, I feel like on the federal level is then it's like, all right, then we'll give status to essential workers. So I think it's really important that we say we cannot leave immigrants out generally, right? And I think what Seema said is really important, that echo chain or that echo chamber is out there around immigrant rights right now. And that you call your senators, because they're the ones that are, especially if you live in Texas or Florida or some of these other states, that right now is the time to call your senators to say, don't exclude immigrants.
I want to let you all go and be respectful of your time, but could you hold on a couple more minutes just because we had one question in the chat I wanted to ask you all about. The question is, what are the suggestions you all give to a person who's applying for a job now, who doesn't have office environment experience, but has done community and volunteer work for years? What are the key points you as an ED look into for those applications?
I look for experience, honestly, over education. And it's not about an office work. It's like, how much experience do you have in the community that you're trying to work in? How much experience do you have, whether it's organizing officially on your title or not? Like, how have you approached your work, right? And what is that letter that you're writing to us in terms of your interest, sometimes over your resume? I've made a couple of blind hires that where, you know, they had no organizing experience or no experience in what they were doing, but they knew the community, and it's turned out really wonderful for the organization. We also try to hire out of our membership if we can, or kids of our members, whatever it may be. So I think experience tops the education for us.
Yeah, agreed. You know, we're still hiring in this period, and I think, you know, definitely just looking for people who understand the community, and, you know, the skills can be learned, you know, so I think if you can show your commitment to mission and the work with some baseline, experience or skills, then, hopefully you'll find a way and, and be persistent, of course. It does make a difference if you call a few times, because then I feel guilty and I'll call you back.
I just want to add, I know the person who asked the question is a good friend of mine, and I would say that I understand where they're coming from in terms of like, and there are like oftentimes, we're working in nonprofits where oftentimes there are challenges where people, you notice, I've seen in other spaces, I'm not saying any of us, but the professionalization of nonprofit work, right? Where it's like, oh, this person with a PhD or a master's degree, surely knows more, but it's really not the case. I've all been hearing and saying that experience matters, and that grassroots community experience, you cannot have a degree on that. You need to know your community, need to be able to know how to interact within the community and build momentum. And that's key, in terms of that kind of work, especially when it comes to organizing. So I think it's really finding that right space where, your interests fit with the right organization. Yeah, but I mean, we have also recently hired during this time, but I'm sure like the number of opportunities aren't as high right now as they would have been, but it's definitely, I understand the challenges, but I think don't lose hope. And I know that you're an amazing person, and organization will be lucky to have you.
Yeah, I would agree with all of that. And I think having a demonstrated track record around volunteering, doing this work unpaid, I think shows a real level of commitment. And I would also say for those who are able to afford the flexibility, I know a lot of organizations who are hiring now are facing, budget cuts or uncertain funding in the future. So if you as a potential employee have the flexibility to, to come on as a consultant versus a full-time staff hire, to be open to those possibilities. Again, if that is a financial decision that you're able to make for yourself, I think that also is helpful in this time.
Okay, I have one last question for you. It's two parts, sorry, and then I'm done. And I would be remiss if I don't ask this question. What characteristics and skills do you think are needed for women of color EDs to succeed? And also, what are you doing to take care of yourself right now? It's very challenging and a lot's falling on you all. Like, how are you staying sane and taking care of yourself? Because it's hard, and especially as women of color, you already take on so many things. And then now you're ED of this organization trying to help everyone who you serve. Like, what are you doing to take care of yourself?
I mean, I could start, I think in terms of, I feel this desire to demystify the ED, role, as Pabitra said, similar to myself, and I saw others nodding, like, never intended to be in this role. I just kind of found myself here, so I think defining what success is something we all need to think about, but I think, this work is very fulfilling in many ways, and gives, how you think about what success is, might be different for different people. It's not about money, it's not about status, it's really about how you're able to live with some purpose. And I consider myself very fortunate that I've built a career around things that I care about and get to work with people who, we work in an environment where we could be honest and, share our experiences and not in a competitive space all the time. But in terms of how I'm caring for myself, I take a walk daily, basically as soon as I'm done with my day, no matter how exhausted I'm feeling, just get out and walk. And that has been a lifesaver for me. And luckily I'm able to do so in DC. I think that is key. And music helps a lot as well.
Krittika, do you want to add anything?
Sure. Okay, I'll be honest. I am one of those people who, if you ask me what I wanted my career to be 20 years, I would have said I would want to be an ED of an organization that serves DDSA survivors. So technically I'm living my dream, right? But it's, you know, one thing when you get to that point, you know, because it's like one thing when you're like seeing it from outside, and then when you're in it, it's you know what Seema said about really having that passion is important. No, but none of us, I'm sure, are doing this job for the money, because yeah, we're not making that much. So you know, but I think that more than my characteristics, because I don't think there's what, you know, here's a list of characteristics. I would say that if you ever get to this point, or at any point of like leadership, having access to a strong support system is essential. And that includes fellow EDs, because I cannot complain about things to my staff or about other people who manage us, who I would not go and label, but like, you know, we are also responsible to people, right? So I think we need to have that support system to survive through this emotionally. And also be prepared to go through very high highs and low lows. You know, like, you know, you might be like, oh my God, I got this grant, and oh my God, I have, you know, we got a funding cut, you know, like at the same time, you know. So it's just like, you know, it's challenging. It really is challenging. And we know that in the nonprofit world, that burnout is real. And I'm not, I wish I could be like, I'm taking care of myself so well. No, like I really am not. Like, I think work has been my main focus through the pandemic. And that's the only one thing that I'm doing remotely well, I think. Otherwise, I'm like watching Netflix and watch all the crappy shows in the world. But like recently I realized that this might be going on for a while. So I restarted a book club with my sister and a friend. We were in a book club 20 years ago, and we just restarted it. So we're going to be reading, I haven't read a single book during this pandemic because I just can't focus, you know. So let's see where that goes. I also take an online Bollywood dance class and a Zumba class. So that's kind of my movement. So those are the things I'm doing to stay, you know, well. And it's okay. It's not like a competition and who's, you know, being the best at whatever they're doing, because I can only do one thing well, is what I've realized right now.
I think that's right on. Like, I think especially as EDs of color and EDs that are women of color, like support systems are key. So I've really learned to find who the other EDs are that I can call at a moment's notice, or text and say, WTF, what, you know, like random stuff that you can't say to your staff or other folks. And so finding those kind of trust networks are really, really key, and have been really key right now. I think for me, you know, being a parent and having to also negotiate time with my partner who owns a business, like really trying to be like, if I'm going to be with and it took a while to do this because COVID response took over our lives at Adhikaar until really last week. And so just to be like, look, if I'm going to be with my kid, put my phone away and just focus on painting with your fingers, or focus on doing these random things, right? And I think there's like that reality of like, hey, just stay focused on your partner and your kid as much as possible. Because it's easy to be like, oh my God, I forgot these 10,000, 20,000 other things that I have to do. What about this funder? And why did they do this to us? You know, like, and I think that's been helping me. I also love to cook, so been cooking a lot. But I think that one of the things in terms of being an ED as a woman of color is there's a reality that, you know, there's a study that came out, and I remember another ED friend posted it, and it was like, women of color led EDs, women of color led organizations, or I don't know if it was people of color led organizations, like really get shafted in terms of the money, right? Like a funder will give us like 10K or 20K and be like, we should be so happy to be getting that money. I want to be like, but you gave like $500,000 to that organization over there. Why do you think we continue to stay small? Is because we continue to get shafted, and we have to prove ourselves so much more. And I'm tired of that game, right? So I think that for me, it's been trying to have really honest conversations with even people that hold power over us to say, you know, we're not going to do that, or no, that's not how we approach this. And sometimes it means we lose funds, right? But I think that the bolder we can be with funders and those that hold power in that way, and the more united we are in those ways, the less that we can stop those disparities. Because it is true that organizations that are run by folks of color get less and have to prove themselves more.
Yeah, absolutely agreed with what everyone has shared. And I think along those lines, one of the things that I have found most energizing as an ED in just the last few months has been being able to really model the change internally that we want to see externally in the world, because that's a place where at least we have, in a lot of ways, more control. So those same principles of equity and justice, bringing those into the organization, I think is so critical, because like Pabitra was saying, we are not only battling these capitalist, white supremacist, male-dominated forces, but in some ways also being forced to replicate them to be seen as successful, whether that's in leadership style, whether that's in how we treat our employees, how we use our resources. So I think really pushing back against those types of narratives and ways of leadership is really critical, and is, I think, such a great way to build a microcosm of what we want to see internally by pushing back against that. And then just want to emphasize, I think, the strong network and finding that. And I think during this time, it can feel very isolating for everyone, even if you have a strong network. And so finding the ways to communicate that makes sense during a time of isolation and quarantine, I think, is an ongoing challenge. And I think for me, I've been lucky during this time to be able to be at home with family. So I actually, if I don't show up for a meal, my parents are like, where are you? You need to come eat right now. You can't go to this meeting. So I've learned how to space meetings out so I can eat properly with my family, which is I haven't done in like 20 years. And actually get 8 hours of sleep a night, and go walking, like Seema said. These are all things that we end up doing as a family, and that's been really energizing too. And then the last thing too, I think, for those of us who have the privilege of being able to pause a little bit right now, is we can actually reimagine a different kind of world. I think everybody touched on that and what that could look like, pushing back against capitalist systems. And all of that. And so I think that there's a little bit of time to think about and to take a step back. And I find that very energizing and inspiring too, is that we can actually take this time to recreate things in a very different and more powerful way. So.
Thank you all. I just want to say thank you to our phenomenal panelists tonight, and thank you all for joining us. All your organizations are amazing and critical to the proper functioning of our society in general. So thank you for being here and making time to speak. Also, DFP and SABA-DC are going to continue to do good work and program, and we hope to see everyone at an event online soon. Nisha, do you want to add something?
Yeah, I just wanted to thank all of you all again. It's so, every time I hear all of you speaking, it's very, very inspiring. And so to hear, your stories and also all the work that you all have been doing is super critical. And I just want to let everyone else know that we'll send out an email that has more information, including all the links that our panelists provided and ways that you can help support. So we'll make sure that information gets out as broadly as we can. And yeah, like Mo said, stay tuned for more programming. Thanks to SABA-DC and of course to Mo for the work you've put in on bringing us all together and moderating. And with that, I will leave it there.
Yeah, and just one more thing for SABA-DC. They have an event minding burnout, COVID-19, and your mental health, just in case anyone's interested, tomorrow night. But thank you so much to the panelists, and thank you for everyone for attending. Everyone have a good night.
Thank you.
Bye.